Welcome to the deep dive. Today, we're tackling a topic that might seem very specific, but actually tells us a lot about our dog's health.
Mm.
Nasal dermatosis.
Mhm.
Basically, we're talking about conditions that affect the skin of their noses.
Yeah.
Both the furry part on the bridge and that smooth, non-hairy bit, the nasal planum.
Yeah, and what's really interesting, I think, is how something that looks like just a simple change on your dog's nose, maybe, like a slight color shift or a bit of roughness,
Yeah.
it could actually point to a whole bunch of different underlying causes.
Exactly. It's like a tiny clue.
It really is. It can be the tip of the iceberg sometimes.
And that's what we want to explore today. We're going to be digging into the different kinds of these nasal skin issues, what might be causing them, and importantly, how vets actually figure out what's going on.
Right.
So if you've maybe noticed something on your own dog's nose, or you're just, curious about canine physiology, this should be a really useful deep dive for you.
Definitely. And if you think about the skin, right, it's the body's main barrier, our first line of defense. And the nose, specifically, also has glands that help keep it moist. And another factor is age. A dog's age can definitely make certain nasal conditions more likely.
Okay, let's maybe start there then. With something called signalment, which I guess is like the dog's profile, breed, age, that sort of thing.
Exactly.
Signalment. It seems like certain breeds are just more prone to specific nose problems.
They really are.
Like if you have a young dog, say, under a year old, things like dermatophytosis, that's ringworm, right?
That's the one.
Or zinc-responsive dermatosis, I see that's common in huskies and malamutes.
Yes, Siberian Huskies, Alaskan Malamutes particularly.
And also dermatomyositis in young collies and shelties. Even Demodex mites, dermatocosis, seems more common in younger dogs.
Yeah, often seen in puppies or young adults. And then there's eosinophilic nasal furunculosis. That can happen at any age, often triggered by insects.
Insects, okay.
Yeah, it's quite interesting how genetics and development seem to play a role. Take those larger breeds that grow really fast. That rapid growth might somehow be linked to why they sometimes get that zinc-responsive dermatosis. And then you have uvea dermatologic syndrome. We see that more in Akitas, Samoyeds, Huskies.
Oh, yeah.
It affects the skin and the eyes. It shows how seemingly separate issues can be connected, often through the immune system.
And that list of breed links is pretty long, isn't it?
It is surprisingly long.
We've got SLE and DLE lupus, basically.
Systemic and discoid lupus, yeah.
More common in collies, shelties, German shepherds. And DLE might be more in females.
There's some evidence suggesting that, yes.
Then there's epitheliotropic lymphoma, a cancer, sadly, more in older dogs. Nasal arteritis, that's inflamed blood vessels in St. Bernards.
Correct.
Nasal solar dermatosis, which sounds like sunburn.
Pretty much, yeah. Sun damage.
More common in dogs with light-colored noses. Makes sense.
It does.
Even things like nasal parakeratosis in labs, idiopathic nasal hyperkeratosis in older cockers.
That's a thickening, yeah.
Seasonal nasal hypopigmentation, where the nose color fades sometimes. In labs, Goldens, Huskies, Bernese mountain dogs.
Often called snow nose sometimes, though that's not really a technical term.
Right. And vitiligo, like
Yeah.
in people, in Dobermans, Rotties, Dachshunds, and even something called clown nose.
Reactive histiocytosis, yeah.
Yeah.
Because of the sort of reddish swelling it can cause.
Yeah.
Seen sometimes in Bernese mountain dogs and Goldens.
Wow. It's quite a spread, all tied to breed.
It really highlights why knowing the breed is so helpful for the vet. It gives them a starting point.
Yeah.
It doesn't mean only these breeds get these things, but it raises the suspicion for certain conditions.
Okay. So knowing the breed helps narrow it down, but what about what we actually see? What are the visible signs? What should you look out for?
Right, the clinical signs. Well, you might notice a color change first. It could lose pigment, get lighter, that's depigmentation.
Okay.
Or it could actually get darker hyperpigmentation. Redness is common too, erythema. Then you can get more serious things like erosions or even ulcers where the skin surface breaks down.
Ouch.
Yeah. You might see some bleeding, hemorrhage, sometimes little bumps, vesicles or pustules filled with fluid or pus.
Okay.
As things heal or progress, you might see crusts forming. And in some cases, unfortunately, scarring can happen or alopecia, hair loss right around the nose area.
Hair loss, too.
Yeah. And finally, some conditions cause nodules or plaques. Those are sort of raised, thickened patches of skin.
That's a lot of different possibilities just visually.
It is.
And I can imagine any of those would be pretty worrying if you saw them. So what's actually causing all this? What are the underlying factors?
Okay, this is where it gets complex, but we can kind of break it down. First up, Infections.
Infections, right, like bacteria.
Exactly. Nasal pyoderma or furunculosis
Yeah.
are bacterial infections deep in the skin of the nose. Then you've got dermatosis, caused by those little Demodex mites we mentioned.
Hmm.
Dermatophytosis, that's ringworm fungus. And there are other fungi, too, like Cryptococcus, Sporthrix, Aspergillus. They can all potentially cause nasal lesions.
Okay, so infections are one big group. What else?
Next, we have the immune-mediated diseases. This is where the dog's own immune system gets confused, basically, and attacks healthy tissue.
Right, the autoimmune conditions.
Precisely. We mentioned DLE and SLE, the lupus types,
Hmm.
but also things like pemphigus foliaceus, pemphigus erythematosus, pemphigus vulgaris. These are blistering skin diseases.
Yeah.
And eosinophilic nasal furunculosis fits here too, partly. Even if triggered by insects, it involves an over-the-top immune reaction.
So the body's defenses kind of go haywire. What about like stuff in the environment? Can that cause nose problems?
Oh, absolutely. Environmental factors are definitely a trigger sometimes. Mosquito bites can cause a direct reaction, mosquito bite dermatitis.
Makes sense.
Then there's the sun damage we talked about, nasal solar dermatosis,
Hmm.
and contact hypersensitivity.
Like an allergy?
Yeah, an allergic reaction to something the nose touches. Could be a plastic food bowl, maybe even an ingredient in a topical medication like neomycin sometimes.
Ah, okay.
And yeah, insect bites in general can be a trigger.
Gotcha. Are there any other sort of miscellaneous causes?
Yes, quite a few actually fall into another category. Things like arteritis, inflammation of the arteries in the nose.
Right.
Dermatomyositis, which we mentioned has that breed link. Zinc-responsive dermatosis again.
Mm.
Uveal dermatologic syndrome. There's also superficial necrolytic dermatitis, which is often linked to liver disease or pancreatic tumors.
Oh, wow.
Vitiligo, the pigment loss. Idiopathic nasal depigmentation, where I just don't know why the pigment disappears.
Idiopathic meaning unknown cause.
Exactly. Idiopathic sterile granuloma, a lump of inflammatory cells, but no infection found. Idiopathic nasal hyperkeratosis, like thickening and cracking. Even distemper virus could cause skin signs on the nose, though thankfully vaccination makes that rare now.
Good point.
And then, of course, trauma, just a physical injury.
Mm-hmm.
And sadly, neoplasia cancer. Things like squamous cell carcinoma, basal cell carcinoma, epitheliotropic lymphoma, fibrosarcoma, cutaneous histiocytosis. Several types can affect the nose.
Wow. That is an incredibly broad list of causes. It
Yeah.
really drives home how something that looks similar on the surface could be caused by so many different things.
It really does.
So, okay, we talked about breed as a risk factor. Are there other things that make a dog more likely to get these nasal issues?
Yeah, definitely. For instance, having adult cats around, cats can carry ringworm fungus without showing any signs themselves,
Yeah.
potentially passing it to the dog.
Oh, interesting. Didn't know that.
And just a dog's natural behavior, rooting around in the dirt with their nose,
Yeah, they do that a lot.
that increases the risk of picking up bacteria, causing pyoderma or fungal spores, causing dermatophytosis.
Makes total sense. Their noses are right there in the action. What else?
Well, we keep coming back to sun exposure, but it's important. It really does predispose dogs to nasal solar dermatosis, and it can worsen immune conditions like DLE, SLE, and pemphigus erythematosus.
Right.
And dogs with pink or lightly pigmented noses are just much more susceptible to sun damage, raising their risk for both solar dermatitis and, unfortunately, squamous cell carcinoma.
Okay.
We mentioned the large, fast-growing breeds and zinc issues. Also, anything that suppresses the immune system, maybe another illness or certain medications like steroids, that can make them more vulnerable to infections like pneumococcosis, pyoderma, and ringworm.
Right. A weakened defense system.
Exactly. And finally, insect exposure, clearly linked to mosquito bite dermatitis, but maybe also plays a role in triggering that eosinophilic nasal furunculosis.
So knowing these risks is helpful. But okay, the dog comes into the clinic with a sore nose. How does the vet actually figure out which of these many possibilities it is? What's the diagnostic process like?
Diagnosis is often about differential diagnosis, basically making a list of possibilities based on the signs and history, and then ruling things out.
Like detective work.
Very much so. For example, distinguishing between nasal solar dermatitis, DLE, and SLE is crucial because treatments differ.
How do they do that?
Well, solar dermatitis is linked to sun, affects light noses, and a special test, direct immunofluorescence, or DIF, is usually negative.
DIF.
DLE is mainly nasal, gets worse with sun, often starts with pigment loss.
Oh.
The DIF test is often positive for DLE. In a biopsy, a small tissue sample shows a specific inflammation pattern called interface dermatitis.
Biopsy seems key.
Very often, yes.
Hmm.
SLE is more body-wide, systemic. It often affects the nose and face, but other areas too. Dogs with SLE usually have a positive ANA test, anti-nuclear antibody, and also a positive DIF.
Okay, so those tests help sort out the lupus types. How about differentiating them from, say, pemphigus?
Good question. Pemphigus foliaceus often starts in the face, ears, maybe foot pads. Biopsy shows these little pustules under the top skin layer, subcorneal pustules with separated skin cells. That's called acantholysis. DIF is positive in the epidermis.
Acantholysis, separated cells. Got it.
Pemphigus erythematosus is mostly face and ears, often looks worse than DLE. Biopsy shows similar pustules within the epidermis, pigment changes too, and the DIF can be positive both deeper down at the basement membrane and between the epidermal cells.
Complicated.
It can be. Then Demodex mites, dermatosis, usually affects the face, the hairy parts of the muzzle.
Yeah.
That's usually diagnosed just by scraping the skin and looking for mites under the microscope. Much simpler.
Okay. What about things caused by contact, like that plastic dish issue?
Right. Plastic dish dermatitis usually looks like pigment loss and redness just on the front of the nose and lips. Usually no ulcers or crusts.
Mm-hmm.
And there's the history of using plastic bowls.
Mm-hmm.
It's like a contact allergy, but sometimes it might just be mild irritation or trauma from rubbing. Dermatomyositis, we know the breed links. Young dogs usually. You see lesions on the nose, face, extremities, often where there's pressure or trauma. Biopsy shows the interface dermatitis again, plus shrinking hair follicles. DIF test is typically negative, though.
And there's still more to rule out, right?
Oh, yeah. Uveidermatologic syndrome, again, breeds like Akitas. Often the eye problems, uveitis, show up before the skin signs.
Oh, okay.
Then you see pigment loss on the nose, lips, eyelids, often with white hairs growing in those areas. Early biopsies show interface dermatitis and pigment changes, zinc-responsive dermatosis breed or diet link, crusty lesions on the face, junctions of skin and mucous membranes, pressure points, foot pads. Biopsy shows that abnormal skin layering, perikeratotic hyperkeratosis.
Perikeratotic hyperkeratosis.
And then for things like bacterial pyoderma, ringworm, eosinophilic nasal furunculosis, vitiligo, the idiopathic pigment loss or thickening, and cancer. Diagnosis often relies heavily on history, plus specific tests like cultures or, very importantly, biopsy.
So it sounds like beyond just looking, there are quite a few specific tests vets might use.
Absolutely. We've hit on several. Skin scrapings for Demodex. Cytology, looking at cells from swabs or smears, can spot fungi, bacteria, cytophils, or those cantholytic cells in pemphigus.
Cytology, right?
A DTM culture for ringworm. Other fungal cultures on Sabrad agar. Bacterial culture and sensitivity for pyoderma to guide antibiotic choice.
Makes sense.
If SLE is suspected, maybe a joint tap to look for arthritis, plus that ANA test. A thorough eye exam is vital for uveidermatologic syndrome to check for uveitis. Sometimes an ECG for heart issues in SLE, or an EMG for muscle inflammation in SLE and dermatomyositis. The DIF test is really valuable for detecting antibody deposits in DLE, SLE, and the pemphigus group.
Mm-hmm.
And for cancer, cytology or biopsy is essential to identify neoplastic cells.
And basic blood work, like CBC, chemistry.
Usually those are normal in many of these conditions, but there are exceptions.
Mm-hmm.
SLE might show things like anemia, low platelets, kidney issues, joint inflammation markers, so routine bloods are still important baseline tests.
Okay, that gives a really clear picture of the diagnostic journey, and the biopsy seems critical. What kinds of things might actually be seen under the microscope? What are those pathologic findings?
The microscopic view can be really informative. If there's inflammation around hair follicles, folliculitis, or deeper furunculosis, you'll see inflammatory cells. And sometimes you can actually spot the cause, like mites, fungal bits, or bacteria.
Right there in the tissue?
Exactly. If it's mosquito bites or eosinophilic nasal furunculosis, you'll typically see lots of eosinophils, those specific white blood cells.
Okay.
Dermatomyositis often shows shrinking hair follicles, follicular atrophy, and scarring around them, parafollicular fibrosis. Interface dermatitis, that inflammation at the junction of epidermis and dermis, is characteristic of DLE, SLE, dermatomyositis, and uveidermatologic syndrome.
That pattern keeps coming up.
It does. It's a key pattern. The pemphigus types have their own signatures. Those pustules within the epidermis, plus the cell separation, acantholysis, in PF and PE. In pemphigus vulgaris, the separation happens a bit deeper, just above the bottom layer suprabasilar acantholysis. Zinc responsive shows that perikeratotic hyperkeratosis, the abnormal outer layer. Vitiligo and uveidermatologic syndrome might just show reduced pigment hypomelanosis. A specific kind of inflammation called granulomatosis or pyogranulomatosis dermatitis can pop up in infections, bacterial, fungal, reactions to foreign material, or that idiopathic sterile granuloma.
Mm-hmm.
And of course, if it's cancer, like cutaneous histiocytosis or others, the biopsy will show an infiltrate of neoplastic cells.
So microscopic details are vital. Okay, once you finally have that diagnosis, what's the general approach to treatment?
Well, the good news is most cases can be managed as outpatients at home.
That's good.
The main exceptions might be really severe, SLE needing intensive care, or tumors requiring major surgery or radiation.
Right.
A big part of management for several conditions, TLE, SLE, PE, solar dermatitis, squamous cell carcinoma, is reducing sun exposure. Sun avoidance is key.
Makes
For pyoderma and dermatophytosis, trying to discourage that rooting behavior helps. Insect protection is generally wise. Warm compresses can help gently remove crusts, and if contact allergy is suspected, definitely switch away from plastic bowls and avoid known allergens.
Okay, those are good general measures. What about specific medications?
Right, that depends entirely on the cause. For fungal infections, you'd use systemic antifungals pills or liquids like greaseprevir, ketoconazole, itraconazole, maybe a topical like enolconazole for aspergillus.
Mm.
Sometimes early localized fungal spots can be surgically removed.
Mm-hmm.
Nasal solar dermatitis often gets topical steroids, maybe antibiotics if infected, and definitely sunscreen ongoing.
Mm.
Idiopathic sterile granuloma might be surgically removed if small, or treated with immunosuppressants like steroids, maybe azathioprine, cyclosporine, or that tetracycliniacinamide combo.
Okay.
For DLE and PE, milder cases might respond to topical steroids or tacrolimus, or oral tetracycliniacinamide.
Mm.
More severe cases might need stronger oral drugs like those used for.
For the more serious pemphigus.
Exactly. For PF, PV, and SLE, you often need stronger immunosuppression drugs like prednisolone, often with azathioprine for dogs, or maybe chlorambucil, or even chrysotherapy, which is gold injections.
Gold injections, wow.
Yeah, less common now, but still an option. For vitiligo or idiopathic pigment loss, sadly, there's usually no effective treatment. Cancer treatment depends on the type, surgery, chemo, radiation.
Got it.
That idiopathic nasal hyperkeratosis, the thick nose, can sometimes be softened with topical antibiotic steroid creams or special topicals like tacrolimus or things that break down keratin and add moisture. And for anything else, treatment is really tailored to the specific cause. And vets always have to consider potential side effects or reasons not to use certain drugs like avoiding gold salts if there's kidney disease.
Right, need to be careful. So finally, once treatment starts, what's the follow-up like? Any potential problems to watch for?
Monitoring really varies. It depends on the disease and the treatment. Some need frequent checkups, maybe repeat tests to see if treatment's working. Others might just need monitoring at home. As for complications, scarring is possible, especially after deep infections. Or sometimes, if cleaning is too aggressive, that can cause irritation too.
Gotcha. So wrapping this up then, it's really clear that canine nasal dermatoses are, well, it's a complex area.
Definitely
A
is.
huge variety of conditions, loads of different causes.
Yeah.
Getting the diagnosis right involves looking at the breed, age, the signs, and often needs those specific tests, especially biopsies.
Hmm.
And because the causes are so varied, the treatment really has to be specific to the actual problem.
Exactly right. And I think the main takeaway for you as a dog owner is if you see any change on your dog's nose color, texture, redness, crusts, hair loss, anything, get it checked by your vet. Don't just wait and see. Early diagnosis and the right treatment can make a massive difference for your dog's comfort and health.
Absolutely. And maybe just a final thought to leave you with. Dogs experience so much of their world through their nose, right? Smelling, greeting, exploring.
Fundamental to them.
So how might these conditions, even the ones that seem just cosmetic or minor, actually affect their sensory world, their behavior, in ways we don't immediately notice? It kind of makes you think more deeply about their whole sensory biology, doesn't it?
It really does. There's always more going on beneath the surface.
Thanks for joining us for this deep dive.